A new global movement has emerged, uniting communities, civil society, and health professionals. It is the global campaign From People to Leaders, Act on AMR NOW. With over 710 signatories from more than 85 countries, including almost 180 signatures from communities and civil society groups, this initiative is pressing world leaders for concrete action.
We have learned that both structural and individual determinants of AMR are critical, and hence we fully support this campaign because leaders must be at the center of addressing, in particular, the structural determinants of antimicrobial resistance.
Antibiotic Smart Sweden's support for the campaign stems from our conviction that everyone in society can and must drive change together to keep antibiotics working. We need effective methods to engage all levels of society, and this needs to be recognized by our leaders.
AMR, a global health threat hitting the most vulnerable the hardest.
Organization support for this campaign stems from the fact the present approach for the AMR stewardship program as far as governance and policy is concerned is a top-down approach. To complement this, it's imperative that you go to the community, create leaders from this community who in turn can go back to the community and sensitize them on the issue.
Y nos convoco a que nos adhiramos al llamado de la acción global contra la resistencia bacteriana en la convicción de que necesitamos construir una sociedad basada en la solidaridad, en el mutualismo, en la cooperación y en el respeto por la diversidad para poder garantizar condiciones de habitabilidad de nuestro planeta.
Member states must meaningfully engage communities and civil society groups in the AMR response worldwide.
I work with the women from the church, and we are working at Matero UCZ Church. We are working on a project called ABR Literacy Program, where the women are asking, can the AMR language be toned down so that they are able to understand it clearly and go out in the community and disseminate AMR? And the other thing is the women are asking, can we be more visible? Why didn't they know about AMR before? Until we went there and reached out and spoke to them, enlightened them on AMR. Can we be more visible so that the community can know what AMR really is, like it was for COVID, it is for HIV, it is for cholera and malaria?
Member states must prioritize and invest in vulnerable communities for an inclusive AMR response.
UICC supports the call as urgent action is needed to address antimicrobial resistance or AMR for better cancer treatment and care outcomes. Did you know that as many as 1 in 5 patients undergoing treatment for cancer is hospitalized due to an infection? So all the progress made in modern medicine, especially in cancer treatment and care, will be undermined if antimicrobial resistance or AMR is not addressed.
It's important that follow-up steps be implemented to ensure full implementation and to ensure that the threat of AMR is kept in the very short term. This is doable, it is achievable, and we demand that our leaders comply with the demands. Thank you.
A holistic, participatory, and collaborative approach is key to an effective and sustainable AMR response.
This global campaign is the voice of us. It reflects our concern and our devastating pride for support. Please preserve the potency of antibiotics and save the sustainability of antibiotics now. May this campaign is loud enough to be heard. Save microbes, save antibiotics, save us.